Cancer is a pervasive and often life-threatening disease that can be influenced by a variety of factors, including diet. While it's essential to remember that cancer is a complex condition with multiple contributing factors, making informed dietary choices can play a role in reducing your cancer risk. To mitigate this risk, it's crucial to be aware of foods that have been associated with an increased likelihood of cancer development and to limit their consumption. Here are 13 such foods that you should avoid to lower your cancer risk. Processed meats. Processed meats like bacon, sausages, and hot dogs contain high levels of nitrates and nitrites, which are associated with an increased risk of colorectal cancer. To reduce your risk, opt for lean cuts of fresh meat or plant-based alternatives. Sugary drinks. Beverages high in added sugars, such as sodas and energy drinks, have been linked to an increased risk of obesity and certain types of cancer. Excessive sugar consumption can also lead to insulin resistance, which may contribute to cancer development. Red and processed meats. Red meats like beef, lamb, and pork have been associated with an increased risk of colorectal cancer. Processed meats like salami and ham have similar associations. Limit your consumption of these meats and choose lean cuts when you do eat them. Artificial sweeteners. Some artificial sweeteners have been linked to cancer in animal studies. While more research is needed to confirm these findings in humans, it's wise to consume them in moderation and opt for natural sweeteners when possible. Fried and charred foods. Cooking foods at high temperatures, especially when frying or charring, can create carcinogenic compounds. Limit your consumption of fried and charred foods, and use cooking methods like baking, steaming, or boiling instead. Alcohol. Excessive alcohol consumption has been linked to an increased risk of several cancers, including those of the mouth, throat, liver, and breast. If you choose to drink, do so in moderation, and consider red wine, which may have some health benefits in small quantities. Trans fats. Trans fats, often found in partially hydrogenated oils, are associated with an increased risk of heart disease and certain cancers. Check food labels and avoid products containing trans fats. Highly processed foods. Highly processed foods, such as fast food, sugary cereals, and snacks, often contain unhealthy fats, excessive sugar, and artificial additives. These can contribute to obesity and increase the risk of various cancers. Opt for whole, minimally processed foods instead. Excessive salt. Diets high in sodium, often from salt, are associated with an increased risk of stomach cancer. Reduce your salt intake by avoiding heavily salted foods and using herbs and spices to flavor your meals instead. Refined grains. Refined grains like white bread, white rice, and pasta have had their nutrients and fiber removed during processing. They can lead to spikes in blood sugar and insulin levels, potentially increasing the risk of cancer. Choose whole grains for a healthier option. Non-organic fruits and vegetables. Some conventionally grown fruits and vegetables may contain pesticide residues. While the link between pesticides and cancer risk is still debated, choosing organic produce can help minimize exposure to potentially harmful chemicals. Canned foods. Canned foods, especially those with acidic contents, may contain trace amounts of bisphenol A, BPA, a chemical with potential links to cancer. Opt for fresh or frozen options whenever possible. High-sugar snacks. High-sugar snacks, like cookies, cakes, and pastries, can contribute to obesity and insulin resistance, both of which are risk factors for cancer. Limit your consumption of sugary treats and opt for healthier alternatives. In conclusion, while no single food can guarantee protection against cancer, making informed dietary choices can contribute to a healthier lifestyle and a reduced risk of cancer. By avoiding these 13 foods and adopting a balanced, nutrient-rich diet that includes plenty of fruits, vegetables, whole grains, and lean proteins, you can take steps toward a healthier, cancer-preventive lifestyle. Additionally, maintaining a healthy weight, staying physically active, and avoiding tobacco and excessive alcohol consumption are crucial components of a comprehensive strategy to lower your cancer risk. Remember to consult with a healthcare professional or registered dietitian for personalized guidance on dietary choices tailored to your individual needs and health goals.